Ireland, my first time, but I have just been absolutely blown away by the beauty of the countryside. And I actually got off the train today and was handed with a radio station on the phone. And one of the questions they asked me was, what do you think about the air? And I'm thinking, well, I just got off the train. But what I said was, and this was true, coming up here and looking around, this is such an amazingly beautiful, precious area. I just cannot imagine a drill rig coming in here, letting the oil and gas corporations come in here and frack this area and destroy it. And so, cheers to you all, and may you prevent that from happening. Just want to run through a little of the science that we've sort of dealt with. I have a little bit of a background in biology, and I've kind of been a liaison over the years between the health professionals and the scientists and the activist groups like ours is. It's come a long way in the 4 or 5 years we've been working on this. I'll tell you, when I first went to Dimmock, Pennsylvania in 2011, I drove down there on a 50,000-gallon water delivery truck because we New Yorkers were helping our allies in Pennsylvania, affected residents whose water was poisoned. How would you know it's poisoned? It lit on fire, it came out brown, people were getting sick, any and all of these numbers of reasons, but the oil and gas industry, which had been forced to deliver water, was no longer delivering it. So we went down there and we delivered water. Across these areas of Pennsylvania, not just Dimmock, northwest Pennsylvania, different parts of it, you see all of these water buffaloes in people's yards, these giant tanks that are filled with water because they can't drink their water. As Julia mentioned, a lot of them have signed non-disclosure agreements and can't talk about it, but you can't really hide a water buffalo. It's almost like the elephant in the room, if you will. But I tell this because in 2011, no one knew how much water had been contaminated in Pennsylvania. The industry, the government, all maintained that there were no instances of water contamination from fracking in the state. Today, even the Pennsylvania state government, which has tried to hide this, has acknowledged that there are more than 250 cases confirmed of water contamination and failure from fracking. That's a lot of cases off a few thousand wells. We've now seen a fair amount of water contamination in states across the country where fracking is happening, including Colorado and Texas and Wyoming and California, and various others. I think that example goes to illustrate some of the shifts that we've seen in the science. In 2011, 2010, 2009, we had a lot of anecdotal evidence, stories of harm, people talking about the health effects Julia referenced, the respiratory illnesses, the sickness, the harms, the throwing up, the coughing. But we didn't have a lot of empirical evidence backing that up. And this is one of the issues we struggled with early on in New York, where we talk about the harms, but there was a dearth of scientific studies behind it. In the years since we started, in 2010 to now, that has changed. There are now more than 450 peer-reviewed studies and papers documenting the harms from fracking across the country and elsewhere, and looking at the actual mechanisms by which these failures take place. Things like well integrity failures that cause leaks and contamination. Things like air pollution with carcinogens like benzene, endocrine disruptors, other volatile organic compounds. Earthquakes and seismic activities. We've had thousands across the country. These inherent problems, which we see in the United States, in Canada, and in all other parts of the world where this industry goes. The one thing that has in common, aside from the negative impacts, is this common refrain from the oil and gas industry and government, which is that with each new state or each new country they're going to frack, whether it's the state of Michigan, the state of California, whichever one, they come in and they say, we're going to get it right this time. We're going to put gold standard regulations out. We're going to learn from the mistakes elsewhere, and we're going to make it safe. But what have we seen in each one of those states, in each of those areas? We've seen well failures. We've seen water contamination. We've seen earthquakes. We've seen air pollution. We've seen sickness. That's the common connection between these fracking companies and the entire world, is those same problems, because those same problems can't be stopped in Michigan, in Canada, or in Ireland. What New York State did is something that no other part of the United States has done, which they engaged the public health department in the fracking review process. They didn't just look at how to regulate it, how far to put it away from someone's house or a stream or a school. They looked at that emerging science, which has changed a lot over those years, to see how much could this affect people's health? What do we know and what don't we know? And that's where in that same period of time, especially 2012, 13, and 14, most of those 450 peer-reviewed studies have come out. About 75%, 3/4 of all the studies we have on fracking have come out in the last 2.5 years. That's a lot that we know now that we didn't know a couple of years ago when fracking was proposed in places like Ireland or in New York State. A couple statistics, not too bad here. When an independent group in the States looked at the percentages of the studies that showed harm, much like folks have done about climate change, versus ones that showed no impacts, these are some of the statistics they found. Of those studies looking at public health, 96% show significant risks or actual adverse health outcomes. Of those looking at air contamination, air pollution, 92% show elevated levels of air pollutants. About 3/4 of all the papers looking at water impact show water contamination or serious risks thereof. Those are pretty high numbers. And what they ultimately go to show is much like smoking. You can put regulations on fracking. If you put a filter on a cigarette, you're still going to get cancer or have a high likelihood of getting it. The bottom line is those regulations, those promises, are not true. They won't make fracking safe. There's no way to do this safely. There are those inherent problems you cannot fix. We started to know that as our campaign went on. We were calling for ban because we've heard those stories. We've been to Pennsylvania. We've seen the destruction. We knew we didn't want this in New York State. So we called for ban early. Ultimately, all of the concerns we were addressing, based on that anecdotal evidence and what science we had so far, just showed to be truer and truer and truer as more and more studies came out and showed that we were right, and all of the industry's promises were turning to be lies. But, and I think this is really important, although we had all of those studies at the end, and ultimately that's what's in the New York State ban document, the health review that ultimately called the governor to ban fracking, it wasn't just the science, and it's never just going to be the science, not when we're up against the most powerful industry in the world, the oil and gas industry. It was the organizing that Renee talked about that acted as a megaphone to make the science a mandate for public policy. When the state in 2012 to 2013 was adopting regulations to let the fracking start in that year, 2013, we had just this very short window over Christmas to write comments on the proposed regulations. Just in a couple months, we got more than 204,000 comments in that echoed the science that's now in that health review that talked about how these regulations would never protect people in just a couple months. So it's the science, but really it's the megaphone of the people and the political mandate that we can all create by coming out to meetings like this and going to the Common Council meetings or to government officials or hounding the governor, as Renee talked about, everywhere he goes with his universal demand of listen to the science, protect our public health, protect our homes, do not let fracking come in. And that's the same message in Maryland, in Ireland, sorry, we're working in Maryland too. But that's the message in Ireland. Our health, our homes, our families, no fracking. So thank you, and we'll take some questions.